Hi, guys. Thanks for joining us today. I'm Shelby Livingston. I'm a senior healthcare reporter at Insider. And we're talking today about solving healthcare's biggest challenges and how we can truly transform healthcare by going after moonshots, like curing cancer and other diseases and making healthcare accessible for everybody. We've been successful in some efforts, but I'd argue that we failed just as often. And to state the obvious, I think we all know that healthcare is hard. So luckily, there's a lot we can learn from past efforts to improve it. And there's no better time for this conversation as we're in the middle of a giant moonshot right now, which is ending the COVID pandemic once and for all. And we've got some experts on the panel today. We've got Ashima Gupta, Director of Global Healthcare Strategy and Solutions at Google Cloud. We've got Dr. Anthony Nguyen, Chief Clinical Officer at Anthem, and Dr. Troy Brennan, Chief Medical Officer at CVS. Thanks for being here, guys. And for those of you in the audience, we'll be taking questions later on, so please send in your hardest ones. All right, let's dive right in. So I want to get everybody on the same page here. What's a moonshot, and what's an example of a successful one in healthcare? Troy, can you start us off with that? What comes to mind?
So I was saying wouldn't be the best to go first, I don't think, because I'm not so clear on moonshots. I do think it's meant to be sort of disruptive and sudden revolutionary innovation that is targeted, kind of a comprehensive rationality approach. And mostly what I see in healthcare is more sort of incrementalism and kind of muddling through and long-term change. I'd say, for example, sort of COVID pandemic, we had ancient techniques for approaching a pandemic of this sort, none of which we really put strenuously into place in terms of sort of contact tracing and appropriate steps to isolate people, unlike other countries did, for example, China. And then I'd say the vaccines are close to sort of a moonshot, but really, if you look at it, the technology that was developing over a 10 to 15 year period of time. Moderna is a great example. I mean, they were in therapeutic medicine for years, but never had any approved product, but they were plugging away at the science, and that's kind of how science works. So I'm always a little bit skeptical about moonshots, and I guess it'd be probably not best for me to be going on too much longer about them.
Well, luckily, Ashima, Google has its own moonshot factory. So I think you'd have a really interesting take here.
Yeah, absolutely. And there are many definitions of moonshot. From Google's perspective, we do have a Google Moonshot factory. And the definition that we use in that is thinking when you choose a really audacious goal, a huge problem, and a purpose to create a radical solution to the problem using a disruptive technology. So if you think, in Troy, you nailed it, it's not about 10% increment, but 10x impact. And it's pursuing things that sound undoable, but if done, could redefine humanity. So 3 big elements that we use internally: a huge problem in the world that affects millions, probably billions of people. Second, a radical thinking solution that may seem impossible today. And third is a technology breakthrough that gives us a glimmer of hope that in 5 to 10 years, it will be possible. So as Troy said, longer view. And one good example that comes to mind from Google's own innovation is Verily, which is our life sciences company, got outside of Google X. Self-driving cars like Waymo came out of that as well. In healthcare, I would say one of the good industry examples that I found pretty fascinating is around the Human Genome Project. It started in 1990 and involves scientists from 20 different centers in 6 countries, and it took them 13 years and nearly $3 billion to map a human genome. And the result was 21,000 genes, and it provided our understanding of basic biology. 2 decades later, we can now do, like Broad Institute is a customer of ours, they are providing the map within a day. It's under $1,000. But it's not just about the cost. How advanced our understanding of human biology is what is transformational. And the other example, Troy, that you were giving about Moderna and vaccine, that's the early work from the Human Genome Project. When the virus was discovered in late 2019, by Jan 12, the scientists had the virus genome completely sequenced. So that kind of advancement is possible because there's that audacious goal in someone put together the $3 billion budget and a long review that it is possible to read the human code or the life code of the DNA.
Mm-hmm. Anthony, do you have a take on this?
Well, I think here we shouldn't overthink this, because no matter how hard we try or how smart we come up with solutions, there's a big proportion of people in America that still believe anti-malarial drugs are a cure for COVID, and the recent one is ivermectin, right? So I just am skeptical. There's no such thing as a moonshot in healthcare. Base hits are great, and even then that's challenging because there's a lot of people that just don't accept science by and large, as we talk about COVID.
Mm-hmm. Well, you bring up a good point, and so did Troy. I do feel like a lot of healthcare is incrementalism, and I often feel like I'm writing about the same things every year, and there's very little progress on the problem. So what is it about our healthcare system that kind of makes it hard to solve huge problems and move fast, and instead we make very slow incremental progress? Troy, do you want to take that?
Well, I mean, part of it's just the process. I remember talking to people who worked at Haven, for example, and they were working in healthcare, but they were working for, software companies. And obviously, when you're sort of doing an intervention, it's based on retail marketing or digital marketing. You can put a change in place and evaluate that over the course of the next 6 hours. You get enough traffic that you can see whether or not you're really having an impact. In healthcare, on the other hand, you need sort of like months and years to be able to demonstrate that you're actually making progress. So incrementalism isn't a bad thing. It's just part of what we have to do in terms of sort of processes that we pursue. I look at Verta. I remember being introduced to Sammy years ago by Gio Colella and having a very interesting conversation about sort of what his plans were. And I think he sort of stuck to it. And to go to what Sasha was mentioning in the previous section, there has been a lot of science layered on top of and developed in order to demonstrate that the kinds of things that Verta is trying to do actually do work. But it takes time. It takes 6 months follow-up, it takes a year follow-up. And especially when we're talking about chronic diseases, this is about moonshots, about chronic disease, they're so tough to treat. And a diet intervention, for example, you don't get anywhere close to being sort of a gold standard until you've got 12 to 24 months of follow-up. So, a lot of people are excited about the kinds of ways you can move fast in the digital world, but in the healthcare world, there's a long latency period associated with demonstrating true outcomes.
Mm-hmm. Anthony, do you have any thoughts on how we can kind of move faster and overcome some of these challenges?
Yeah, I mean, one is to meet the member where they are. I just got off the phone with our AI team, and they're trying to, come up with, next best action and right on time and digital solution. And I was like, guys, if you talk to my parents, you can try to communicate my dad, but that's just wasted effort. It's kind of like sending somebody messages to a person with severe dementia. It's not going to happen. But you need to engage the caregiver. That's one, and we just haven't focused on that as much because it's not sexy. Number two is we have to be able to engage people in their common language. So one of the things that we developed for some of our provider partners is to white label these smart speakers, and Google is one of our clients as well, so we love them. But to be able to, on a smart speaker device, enable a consumer to use in Spanish, whatever their native language, ask healthcare questions, get information, even book an appointment, and where the information is curated. So we simplify it where there's one or two doctor that we recommend, and it's curated using AI like Match.com and eHarmony. So we match the consumer to the best doctor that also speaks their language and has a great personality that matches them. That's really where my head's around, which is make it more personalized, make it more humanized, rather than just being smarter.
Mm-hmm. Ashima, do
I
you
would
want
add to that, Shelby, and great point, Anthony, there. What we see, and again, I have a lineage in Kaiser Permanente, and what we've seen is behavior change is hard. When we are talking about this technology is an enablement, but at the heart of it is you're engaging with the patients, you're engaging at them at a very human level, and giving them truly empowering tool. But in healthcare, I see, like, I call it three-way clock speed. One is the clock speed of your insurance. Every year you are with one, from employer to employer, or from one insurance plan to insurance plan. The stickiness beyond a year, it's as Dr. Sachin Jan was speaking earlier, it's different from Medicare Advantage, but in general, the insurance premiums are yearly, and that's one clock speed. The second clock speed is health behavior change takes time over a number of years. And third, I would say there's a regulatory clock cycle for having been part of the interoperability from President Obama days to the CMS work with the previous administration to now. There is a regulatory policy clock speed. So the trick is to balance all three: your membership clock speed, your disease trajectory and behavior change, the longevity that takes, and third, the confluence of policy. All these three clock speeds kind of have to match together for a lasting impact. And one of the things that is important for Moonshot is to really be that value and purpose driven. And oftentimes, what we see, a moonshot idea or a longer range idea, is if you're chasing short-term quarterly revenues and year to year, it kind of takes away that value and the purpose that you want to see in the longer term. And what you measure is what you get. Is if that's what you're measuring, your EBITDA, your earnings quarter by quarter, versus how is it changing the trajectory of a disease over a longer period, like 10 years, 15 years. Can we really, there are 450 million diabetics in the world. What can we do to reverse the trend of diabetes? I think that's the audacious goal. So I think that's where these three clock speeds have to kind of come in some rhythm.
Gotcha. Good point. Well, I'm interested in who you guys think is going to spearhead the next big innovation. Will it be the incumbent players, CVS or Anthem? Will it be companies that traditionally were outside of the healthcare space, like Google or Amazon? And or could it come from the startup world or the public sector? Anthony, who do you think is most likely to?
Yeah, well, I'm bullish that our government, CMS, is really driving a lot of the changes that I've seen and I agree with through the STARS effort, through quality, through the CAP survey. I think they're doing some really amazing things, and it's driving changes, and people are adopting. So whether you're doing business in the Medicare Advantage and then also in other lines of business, you just can't help but then ask, hey, why not Medicaid? Why not commercial? So I think what we're seeing out of CMS is very exciting.
Mm-hmm. Ashima, will Google be the big disruptor in healthcare?
We are an enabling technology, and I will tell you, it will be an ecosystem. It will take all parties. It will take Humana's, CVS's of the world, where you have the first patient contact. It will take technologies like Google is building from AI. But then we are an enablement arm. It's a means to an end. And as we're talking about, CMS is a huge role to play as well. So truly, it will be an ecosystem collaboration. No one alone can do it. I think that's where we've seen with COVID, by the way. One of the important legacies, if you take past 18, 20 months, one of the important legacies that COVID is the way it changed forever the collaboration of ecosystem. Be it pharma companies who normally compete, come together, be it academic research around the globe. And I hope that's the model we all see going forward about the ecosystem collaboration. And it is COVID pandemic, if anything, that level of collaboration has been inspiring, and hoping that stays.
Mm-hmm. Well, I want to get into some of your company's own strategies. One of the things I'm interested in, Troy. So, I mean, CVS has so many moving parts, from pharmacies to a PBM to a health insurer. And I'm curious, how do you get all those moving parts to coalesce around a singular strategy to fix a big problem? And what do you think you're best positioned to solve in healthcare?
Well, I'd go back to the previous question. You sort of look for the right place. CMS, man, they're so plotting. It's taken, like decades to get to an answer on surprise bill. And now they're sort of stuck making regulations for another 18 months. So you can't look to them. Big companies like ours or Anthem or others that are already in healthcare, they're big, they're plotting. It's hard to sort of see that they're kind of leading the change. The new companies, technology companies that are coming in, they get very excited about it, and then all of a sudden they blow up their healthcare thing, and it goes away for another 4 or 5 years, and then they're back again. So, it's hard to say exactly sort of where the change would come from given that lineup. But on the other hand, I think everybody's beginning to see, as you suggested, and I think as Ashima was mentioning, that there's going to be a lot of sort of hybrid solutions and a lot of learning that are going sort of across different kinds of companies and collaborations between companies that I think are going to make a lot of things possible. And we can harness ourselves, I feel like, to Moore's law. Information is moving ever faster, and we're a slow industry to take it up, but we're taking it up slowly. So, Anthony's got people who are working on next best actions. I remember 4 or 5 years ago that kind of proposal about a sort of digital-based, retail-based marketing scheme to try to change behavior. I've been at it for 40 years. I'm pretty skeptical that that's going to work, but it does, and so I'm changed in my mind about that. And I can see a number of other things sort of coming down the line where we're able to get, for instance, a company like ours, which is an insurance company, a pharmacy benefits management company, and a retail pharmacy. Being able to sort of string those things together in a way that creates real synergy for individual patients. Because I think, the guts of it is where Anthony was. You got to go where the patient is. And long term, if we have a real moonshot, what we're trying to do is get everybody covered in the country with reasonable insurance, and insurance that doesn't cost them a whole lot. But I look back, Shelby, probably before you were born, I was at least hanging around healthcare, and I see tremendous progress in that front over the course of the last 35 to 40 years. And I'm hoping that we're going to continue in that direction. So I'm very optimistic both about the sort of future of healthcare and also the future of collaboration between companies like ours.
Mm-hmm. Well, Ashima, we've been reporting on this, and I know a lot of people have. And you kind of brought it up, Troy. Big tech just, it struggles and struggles. And I'm curious about, when you think Google's going to break that mold and not struggle to make a mark in healthcare. Where do you see Google having the most impact in the space?
And so absolutely, I think some of the comments are right on point. I think where Google can help is being that enabling technology. When people ask me, we are not a hospital system, we are not like CVS, Troy, this is the common stat I heard, every 3 to 5 miles there's a CVS, right? So in what we can do as a tech company to build tools, technologies to empower CVS's, Anthems of the world, to really take advantage of the stuff that has worked in technology era and bring it to the world of healthcare. I think that's a sweet spot for us. And frankly, that's what we are good at. But the application of technology in really bringing it to the forefront, and that's where we need to do a better job, and we are already engaging with our meaningful partnerships. So for example, we're working with Mayo Clinic, where we are underneath technology, but they are looking into how do they change the radiology diagnostic workflow, right? We don't understand, neither are Googlers they have radiologists, they have the pathologists, but we are bringing forward that technology that they can take it further and improve their workflows. And now coming back to what is the opportunity, and again, LVMI Kaiser had. It took us many, many years to launch an EHR. And if you look into the healthcare industry in general, 95% of our health systems have digitized patient records. There's wealth of information there. When you talk about Moonshot, imagine most of US population being, their digitized records for 95% of the hospitals. Now, when you ask how much of that data is used for scientific discovery to understand the patient population at large, and the data is in the PDFs and the fax machines, and that's where the opportunity lies, where we have, as a nation, done a wonderful job in digitizing the massive digital health repository. Now the trick would be to understand, based on that knowledge base, that digitized records, and help mine the data. That's where technology's role is, and am I clear in that? But then bringing it forward through clinical workflow, through working with CVS, as they are seeing, can we help a pharmacist perform at the top of their license by serving those insights to them with technology, right? When you talk about AI building blocks, understanding language, natural language processing, conversation, to me, those are the kind of tooling, Lego blocks, but they need to come in the context of that workflow that's ultimately what touches the patients.
Mm-hmm. Well, I want to talk about the COVID pandemic, because arguably it could be considered a big moonshot, ending it. We did get a vaccine in under a year, but we're having trouble getting shots in arms. So I wonder what lessons we can take from the response and use them to solve other healthcare challenges going forward. Anthony, you want to take that?
Yeah, so for me, it's all about relationship. I'm old school, and I think relationships matter, and they matter more than any AI, natural language processing, anything else, because it's about that doctor-patient relationship. And when I challenge my team, I say, for me, why is it, when I ask, why is it that Tinder, eHarmony, Match.com match more people than in any other time before, and more people get married through these platforms? And by the way, the data shows that with these platforms and these AI algorithms, less people get divorced compared to when they meet offline. And so what we are not tapping into is the science of being able to connect people so that they have more meaningful relationships between doctors and patients. That transcends the yearly annual renewal process from an insurance company. When you have that stickiness with your doctor and you trust them, that then drives trust, and people are willing to follow. So if your doctor who you trust says, hey, you should really take this COVID vaccine, that's going to carry a lot of weight. So for me, it's about relationships, and for us to be able to drive greater, deeper, meaningful relationships between patients and doctors, we're going to get more results, more people vaccinated. And then we can leverage that trust to do other things.
Mm-hmm. No, it's a good point. I wonder if there are lessons here in what not to do as well when you're tackling a challenge. And I think our resident skeptic, Troy, could take that one.
Well, what was the question exactly, Shelby? I know as a resident skeptic already, but that happens. What was the question though?
I'm interested in, whether there are certain things that happened during the COVID response that we could, use as what not to do when trying to tackle a big problem in healthcare.
Well, you have a hard time saying that the unforced error wasn't the fact that, use the double negative, you got to be careful, that it got politicized. So there was no reason why. If you look back at previous sort of efforts to vaccinate people, there were always a small number of people who are worried about the ill health, adverse effects of vaccination. But it wasn't really something that sort of crossed political lines. And somehow, we managed to fumble that at the very beginning of the pandemic. And the vaccines became something that the government was forcing you to do, or wearing masks was something the government was forcing you to do. And that became sort of a dominant part overall of the ideology that was sort of governing the country at that point. And so, we have these vast differences, obviously, in vaccination rates. And right now we're demonstrating what happens when you have those vast differences. The states that basically had people who strongly believe that, no one can tell me what to do. This is a matter of personal liberty, and where their politicians dominated, are now the places where the ICUs are filled. I mean, it's simple science that, the vaccinations are protecting some states from their health systems getting overwhelmed, and other places where large numbers of people are unvaccinated because they were politically opposed to it, they're paying a price in terms of their healthcare system. So, we're experts on sort of insurance or health policy and things like that, but not necessarily sort of overall politics. But you'd have to say that's sort of the dominant issue today, is really how we manage to intermingle a public health effort with something that became sort of a notion of civil liberties. And I noticed there was an article by an old law school classmate of mine, Dave Cole, and one of his colleagues from the American Civil Liberties Union. And they made the point in the New York Times on Sunday that, this is not a civil liberties issue. From a civil liberties point of view, you should be in favor of vaccine mandates. So it was much, much more of a sort of political issue. And it's just regrettable from my point of view, and must be regrettable from the point of view of every public health person in the country, whether they're in red states or blue states.
Mm-hmm. Ashima, do you have anything to add on this point?
I think a great point, Troy. I think I would say in general, the public health infrastructure resiliency is something we ought to think as a society, as we clearly saw the importance of it, be the messaging, from that to knowing how many beds are in which hospital, how many ventilators do we need. I think there needs to be a lot of focus both on the public health infrastructure resiliency. That I think that's one of the lessons learned as well, like investing in those kind of programs. And I was part of our cloud COVID response and working with the hospital back in March, April 2020. It was literally Excel spreadsheets being uploaded, like which hospital, how many beds, how many ventilators, and we saw that worldwide, not just in US. I think that public health infrastructure funding resilience will be key, not just to tackle COVID now, but any future pandemics that might come our way in future.
Good point. Well, the pandemic did speed up the adoption of digital health, and I know you've touched on this a little bit in your answers so far. Just more people than ever are embracing getting care online, and funding for digital health is through the roof. So I'm curious, what your visions are at your own organizations for virtual care and other types of digital health, and how we can use this kind of digital health revolution to improve care broadly. Ashima, I know Google Cloud has invested in Amwell, so I'm curious about your vision there.
Thank you, Shelby. Going back last year, as we were looking into how could we be meaningful to our ecosystem, how do we enable different payers, provider, insurance company, they were also coming to big tech in terms of what tools that you can offer. And one thing became very clear, that telehealth was one of the signals that we were seeing, and many of customers were coming to us. So that led to the investment in Amwell, because we didn't have a tool. And we also look into the solution completeness, and that led to that. We're very proud of that partnership. But beyond the COVID, and to see how would telehealth look like 10 years from now, right? So as we know, healthcare transformed from physical only, which has been the reality before COVID. Much of it can be delivered digitally. If it can be delivered digitally, it should be delivered digitally. Why should I, as a mom of two busy teens, take 3-hour trip or 2-hour trip to go to a doctor? So, and then, and also the healthcare experience should move from transactional to longitudinal. So we are looking into, it's not that one-time physical to virtual, it's not about digitizing from physical to virtual, but can we make it more meaningful, more impactful, that interaction? So I give this example, and this kind of ties into how we think of telehealth and building tools. So imagine you're having a telehealth visit with your physician, and the person on the other side is speaking Spanish and the doctor speaks English. Can we help with the language barrier by creating translation, which is real-time closed captioning coming at it, right? So how do we empower that? Can there be a chat bot that's just taking digitized membership card, is able to make the eligibility of benefit cards, or can we automate that mundane task sometimes that take time away from the physician or the nurse? So wherever there can be automation and brought back into that experience is how we're thinking about it. 4 areas we think where more patient monitoring, and you said it, Shelby, that's where the investment is going. But that's where the biggest spend also we see when we talk to our ecosystem customers. Can we give empowering tools? That's how the kind of problem statement we hear from our customers is to the patients to better manage their own health. And to me, telehealth is that tool, but it's going not just from a video visit, it transcends into remote patient monitoring and also asynchronous health. For example, remote diagnostics. We saw during pandemic, one of the companies we work in Latin America, they had several 100,000 visits from very low bar to how they saw the patients. So again, for underserved population, access to healthcare is where the opportunity lies. Can we also, it highlights digital equity. We talk about health equity. To me, there's no health equity without digital equity, especially if you're thinking in future, telehealth, remote monitoring is in the care will be delivered digitally. I think that's another area we are very keen in working with the telcos and figuring out how can we help bridge the gap.
Right. Well, I know CVS and Aetna, you guys have been rolling out a virtual primary care option. And if I recall correctly, you have a new venture fund investing in digital health. So, where do you see digital health and virtual primary care having the biggest impact in healthcare?
Well, it goes back to the last discussion about the pandemic, and as Shima was talking about, sort of people uploading things on spreadsheets. And I remember when we first set up a sort of testing program in one of the southern states, very early on in the pandemic, we said we want to capture these people here so we can do contact tracing. I was talking to the public health people from the state, and they were like, well, what do you mean by contact tracing? And it's just underlining the fact that we have completely starved public health because so much money's gone into therapeutic health. And if we really want to get things straight, we've got to be able to start to see how we combine public health with the provision of healthcare. But I think on the sort of care provision front, obviously we operate large scale sort of retail clinics kind of across the country. So we have, the capabilities of billing over 200 insurance companies, and we're used to, providing care across a large spectrum of people. And we've added, as you suggested, at Aetna, a virtual primary care program. And so we see growth in those things. We've begun to open up what we call health hubs, where we're putting more and more providers. And we think that, not unlike other major insurers, Anthem, Humana especially, and United, I think we'll get closer and closer to sort of working with providers and integrating virtual care into that, because it's cheaper, and what you have to do is begin to sort of understand the healthcare system from the point of view of, I've got a capitated amount of care for this individual, and that's going to be limited, rather than I'm on a fee-for-service merry-go-round. I'm trying to do sort of as much as possible. So, almost all of digital medicine fits so much better with a capitated system than it does with a fee-for-service system. That, I'm very excited by the fact that, there's, according to Rock Health, $14 billion that have gone into sort of digital startups in the first half of 2021. So I think that's pushing us in the direction of a better healthcare system, and certainly one that can be more efficient. And it's been suggested both the other panelists, much closer to people than we're used to, where, we think nothing of having people drive miles, spend a lot to go into a parking lot, and then try to get in to sort of see their doctor. So we're very bullish on it. I'd be curious what Anthony's thinking in Anthem.
Yeah, no, Troy, for me, seeing a doctor virtually is good. Seeing your own PCP virtually is better. And what I mean by that is we have to be mindful of these point solutions because we're inadvertently disaggregating care. And so in this new world, I see this integrated in-person and virtual-based care combined together. It's longitudinally. And, I'm okay, like my teenagers would love to have a virtual PCP because that fits them. I'm concerned about those that are older that have multiple chronic disease. What happens as a retail consumer when you buy something and it's broken? It's difficult to send it back online, but you can just go to your, Costco or Walmart and just return it. That for me is valuable because if something goes wrong, my throat doesn't improve with the antibiotics, I go back to my PCP who ordered it. They have this relationship with me and they know me longitudinally. We're not there yet completely, but in discussion with the AMA, that's certainly where Anthem wants to work with providers to go towards a evolution towards this digitally enabled care.
Well, I like the point about, some of these digital tools fitting so much better in a capitated environment. And I feel like we've been moving in that direction for so long. And it goes back to the point of incrementalism. When you look at the numbers, so few doctors are fully capitated. And when people say they're in value-based care relationships, oftentimes it's just upside risk and not downside risk. But I know Anthem has been working on this. And I'm curious, Anthony, and how we move toward capitation more quickly and whether you think that's the end goal.
Yeah, so I want to rival Troy to be the resident cynic because I'm not drinking that Kool-Aid. Because think about it, we have lots of upside downside contracts, but some health systems, their heart's not in it, right? Especially if they're hospital owned. Some are really in it, some are not. Some are still fixated on having beds filled. So just because you have, you're in a value-based arrangement doesn't mean you're having meaningful impact and doesn't mean that health system has their heart in it. And we have plenty of data to show that as well too. Many, provider groups that have value-based contracting for years have not shown much, value creation, and they're okay with that.
Right. Well, we do have some time for audience questions. If you haven't sent in one, if you want to go ahead and do that. Somebody sent in a question that's interesting to me, and it's about social determinants of health. I'm interested in, this person thinks it's one of the key driving forces to change healthcare. And I'm wondering what your thoughts are on that and how you're applying it to solve some of our big problems. And does anybody want to take that one?
Well, I can give you an example of, it goes a little bit back to something that Sheena said, where, when we were beginning to sort of give vaccinations, we were encouraged by the government to try to make sure that those were distributed in a fair fashion. That is, people who typically would not get access to care would get the ability to be vaccinated. And so we can do that by manipulating which stores we provide vaccines to, and also outreach from those stores, because we have a lot of local sort of marketing. And it took us a couple of tries, and actually it was a set of what might be best sort of considered artificial intelligence solutions that aided our analytics and gave us sort of a second try, because our first effort, we weren't getting there. But, 6 weeks later, we were over-indexing in people of color, in particular African-American people and Hispanic people, and we managed to sort of maintain that. So it's something that you can be fairly proud of. Right? Social determinants of health will become sort of a controversial acronym, label, I think. But, for us, the idea was that the, sort of chronic racism in the country was going to continue to sort of lead some people not to have access to these treatments that they should have had. And we were able to demonstrate through careful analytics that we could, and then reasonable sort of control over our distribution mechanisms, that we were able to overcome that. So I think that's kind of what the whole movement around social determinants on health is about, trying to make sure people who've been the victims of chronic racism, or people who can't afford their medications because they're poor, have equal access to treatments that they need, things like vaccines. So, in that regard, it wasn't a moonshot, but it was a sort of use of technology to solve a problem and come up with what I think is a fairly vital solution. So our statistics to this day, over the course of the last 6 or 8 months, we've well over-indexed amongst African American and Hispanic populations in terms of distribution of the vaccines.
Great. Well, I think we're out of time, guys, but thanks so much for this great conversation. Brought up some great points, and thanks for joining us, everybody.
Thank you.